following is a paid program. Advice and opinions expressed on the program are solely that of Generations Chiropractic, not necessarily WBEV or Good Karma Brands. Welcome in, everybody, to Taking Care of Business. And today we have Generations Chiropractic, Dr. Ali on with us. Good morning, Dr. Ali.
Good morning.
It is starting to feel a little bit more like spring. I'm okay with that.
Someone this morning came in and it's like, oh yeah, did you see like this weekend high of 47 both days? And I'm like, thank you for keeping track of the weather for me, but I'm not going to argue with that no matter what.
No, definitely not going to argue with that. And it immediately has me thinking about getting outside and doing things and being more active, because I know in the wintertime we like to hide in our space and you know, huddle under a blanket and bundle up. And I'm looking forward to being able to get out and do more.
And the last mama that I literally took care of this morning, she's like, oh, and when I then shared the news, because again, one practice member must be a reliable source about weather, so you can then keep passing it along and say it's valid, right?
That's how everything works.
Yeah, exactly. So I'm like, you and the kids must enjoy, you know, looking forward to being able to get outside, playing outside this weekend, you know, stuff like that. And she's like, oh yeah, we've been cooped up way too much recently.
Oh yeah, and the little ones especially, they love to get out and run. And I think the moms and dads that deal with those little ones love to get them out of the house and let them burn off some of that energy as well.
Absolutely. I'm like, inside can just get to be a little stagnant at times.
There you go. Well, of course, we always love having you on because we're going to be talking a little bit about Generations Chiropractic and the services that you provide. And, of course, we'll go ahead and kick that all off by letting everybody know that if you have a question for Dr. Ellie, we welcome you to call in. You can definitely do so at our number 920-885-4446. If you want, you can text us a question as well, and you can do that to 920-887-9595. And we do have Jeff up in the studio. He's more than happy to take those calls and texts and send them our way. Good morning, Jeffrey. And by all means, send them our way if you have a question, concern. And if it's something that you can't answer now, of course, you can always try and get back to people with it. You know, if you want to call the clinic and set up, or call the office, set up a chiropractic visit or an appointment, or if you have questions, you can do that as well. I've got a number 920-885-0641. And if my memory serves, texting a really good way to get that number, because obviously sometimes it's hard to answer the phone if you're in the middle of an adjustment or whatever. Well,
even as a balance right now, I'm like, there's no one immediately at the clinic right now. So, hey, yes, I can listen to a voicemail and then eventually get back to it. But okay, if I can physically see it, even though, yeah, we know all these voicemails, you know, script text these days too, but it's still just easier for me to, hey, okay, I have this in writing, you know, right in front of me, and I can continue a conversation with a text from there.
There you go. It does make things a lot easier. So, Dr. Ellie, let's start by talking about what exactly chiropractic is, to kind of clarify for people who think that it's just those loud bone popping and somebody contorts you into a pretzel kind of thing.
Yeah, definitely not the focus in my clinic. Some clinics, that is still the primary go-to of, hey, okay, pop 'em, crack 'em, rack 'em, that kind of thing, calling it good. But that's not even what we even learn fully in chiropractic school. What we really are learning is that chiropractic is about the nervous system more than even about the bones of the spine or any extremity joints, bones throughout your body. So the nervous system is composed of the brain and the spinal column, then all the nerves that go to every single part of your body. And the brain is what gives the signals to everything. So it's how is the communication from your brain to everywhere in your body rolling and moving, and is it efficient? Is it effective? Or is there room for improvement? So really, chiropractic is so much more about how can we get the brain and body functioning better and more optimally, as opposed to, did I make a loud pop, click, crack with a bone? Yes, we normally get through to the nervous system because you house all of your backbone, you know, that encases your spinal column. The most efficient way is through the spine, through the vertebrae. So yes, we impact that way, but not necessarily do we have to make sound.
Now, one of the things that I sometimes hear people say when they detract away from the idea of chiropractic care is, well, that's for athletes who are super active, or that's for people who want it because, you know, they just have throwaway income to put into elective medical type
or
things.
They slipped and fell on the ice last week, and now I literally have an injury that I need to heal through.
And they don't really necessarily think of it as a regular maintenance thing that can help keep them, you know, in really good health. But that's really kind of what it is.
And that's especially what my focus is in my clinic. So there are other clinics that are a lot more I kind of call them a little bit more the churn and burn of, hey, let's get you through this flare up of falling on the ice, or, hey, you were playing basketball and you sprained your wrist, or, you twisted your ankle. Like, let's get you through some of those things. But they aren't always doing the education piece on why can this be more of a long-term proactive way of taking care of my health. And really my clinic primarily focuses on the health and the wellness and the proactive and preventative education piece as well.
Now, of course, your clinic, named Generations Chiropractic, because you are working with a wide variety of generations of people. Your focus being very much on those prenatal pregnant mamas, and then the postnatal recovery for them, and then those babies and toddlers and those youth as they're starting out things development-wise. And that's a really, we've discussed this before, it's a really important key time to look at, chiropractic care, because it does impact development.
Absolutely. And people are kind of like, well, why would a baby or a toddler need chiropractic care? Or, hey, I've had enough moms recently start with chiropractic care during pregnancy because they're having some hip discomfort. And then another one was like, oh, and I was reading somewhere we can have shorter labor times. Like, is that really a thing? It's like, is that a potential that can come up out of it?
Sign me up, right?
Yeah, and it's like, yes, I want out of pain, and the pain is the number one thing that brought me in, but hearing that this could be a benefit. So even as we get a little bit later in today's session, I'm like, hey, we'll, I'm sure, be talking about what might be some of the things that kiddos or infants, what are some more common presentations we see as to how chiropractic can impact that too.
There you go. Obviously, when it comes to chiropractic, one of the things we should point out is that it is not something that, like, I can't just come off the street, put a sign up on the outside of a building and say, oh, I'm a chiropractor. Like, there is specialized training and skills and things that you have to learn to do what you do. It is a trained field.
Absolutely. So it's like we go through our regular 4 years of undergrad, and then it's still 3.5 years consecutively, no breaks, compressed education there, which is actually curriculum-wise equivalent to exactly that of med school. Right. So it's like we even have more hands-on and anatomy, physiology type courses than even med schools, because med schools do spend more time focusing on different medications and med interactions. So they lose some of that what is basic anatomy and physiology to learn more about medications too. So what I definitely think is cool is, like, let's spend more time learning about the body because I get to serve the body, as opposed to how is this medication going to impact the body too. And there's a time and place for all types of medicine, health, and wellness. That I'm not saying medicine, MDs, doctors are horrible, but we also have a very different niche about how do we want the body to focus optimally.
Right. And it's definitely a different approach to that healing than you would get from a standard, general practitioner or whatever. And one thing we talked about before as well is the body kind of knows how to somewhat heal itself when those communication channels are open and things are working the way they're supposed to, and you don't have hindrances. Mm-hmm. And so chiropractic can really kind of help remove some of those hindrances.
And sometimes people are even confused of, well, what do you mean that the body can kind of heal itself to even begin with? Well, think about a paper cut, or, hey, I do, cut my hand on something. Yeah, it sometimes takes some time, and you're like, how did that little paper cut, cause so much pain? And then eventually, if it is a bigger cut, it'll stop bleeding, it'll clot on its own, it'll scab over, it'll all heal through there. Yes, you might have a lingering scar, but body is back to doing what it should be doing. So that's just a very tangible example of what can be happening on a bigger and more global body scale too.
It does make a lot of sense. Now, of course, in your case, you have done a lot of specialized training really to focus on those pregnant moms, those infants, and those kiddos, because that is a different level of chiropractic than, your across the board, everybody kind of chiropractic.
Yeah, and even when it comes to that niche, it's like, okay, we talked about the general education of a chiropractor, and then my certifications have also been like 2+ additional years of focused and intensive weekends on pediatric prenatal care to then get those certifications. And then even in May, like, I have another week-long seminar where I'm going off and going to be learning about how to, again, help with more pregnancy-related things. And, like, I'm spending the week down in Kansas City for that. So it's like I'm continuing to immerse myself in the pediatric prenatal chiropractic realm, while also it's important to know that chiropractic care, first and foremost, is still for everyone.
Right. Now, when you say for everyone, of course, we're talking all ages, all generations. And we want to touch on a few of them here as the show goes on. First and foremost, let's talk a little bit about the elderly.
Yeah, so sometimes people are like, okay, you've said, your focus and your specialty is a little bit more pregnant moms, kids, and infants. Like, would you even want to see someone who's older? And I'm like, yeah, we definitely do. Some of the things I love the most is when you get multiple generations all coming in at the same time. Like, I can think of multiple families that grandparents, parents, and kiddos all come together. They all carpool, they all hang out. I'm like, to me, that's awesome to celebrate that.
Right.
And that's even just going back to the fact of, yeah, we do take care of the grandparents or the elderly, or, when you start to think those over 65, when it's like, wait, how does this relate to Medicare or that kind of thing? Like, yeah, we do see those people, and it's definitely different when it comes to Medicare. And I'm naturally a cash-based practice, which means we have different membership options, and most people end up paying out of pocket. But we do accept some forms of Medicare in our clinic as well.
Right. Now, obviously, that's generally something where you get do you have to get like a referral or something from your doctor for that, or is it just for certain types of chiropractic care is covered?
Yeah, so Medicare, it can definitely be a very tricky situation, which is why when I hear someone who, hey, I'm 65 plus, or I have Medicare, I'm like, cool, can you get me that information right away so that I can verify what's going on? Because some people might be like, oh yeah, I know I have chiropractic benefits, even though when you're signing up for Medicare, I'm sure chiropractic is not the primary thing you're looking at.
Right.
But some people are like very excited that they can utilize some of their benefits and also get chiropractic care when maybe they never even thought of that as something as a realm in their possibility. But yeah, there's different, obviously, forms of Medicare, supplements, and, Advantage plans. And, we are only in network with straight Medicare Part B. So we'll take that information and look to see, hey, you might have some coverage in the clinic, you might have none. If you have more of an Advantage or a replacement plan, nope, I'm sorry, you don't get the immediate benefits, but we can provide you super bills and see if your company will reimburse yourself.
Right.
And same thing when it comes to just regular insurance stuff. I'm like, hey, we can provide super bills, and if your insurance company will say, props to you for getting chiropractic care and reimburse you, that's awesome. Typically, insurance companies and Medicare don't necessarily, or not just insurance companies. Obviously,
Right.
Medicare is a form of an insurance
Right.
company, but insurance companies and chiropractic don't always go hand in hand because they're like, okay, we're only going to cover this if it's absolutely medically necessary. And we just talked about we want to function optimally. If we're functioning optimally, that doesn't exactly go in line of, well, function optimally versus is it absolutely medically necessary?
Right. Right, because if we're thinking about functioning optimally, that's general maintenance. It's kind of like getting your annual checkup kind of
And
thing.
even going above and beyond, and
Right.
how can I function even better than where I currently am at?
Right, as opposed to medically necessary is more like that I had a slip and fall or whatever, and it's recommended.
So there's even that balance of when it comes to Medicare, hey, sometimes they'll contribute more to this is absolutely necessary, and then you do get some supplement companies are like, hey, I will cover everything for maintenance care because I want you to be staying ahead of your health. So lots of different varieties, but we just want to try to do that lookup for people. And I know some are like a little weird. Why would you want all this information before I even walk in the clinic? It's because I'm trying to do you a service. I'm trying to help you out there.
That makes sense. And of course, when you're looking to get, care, be it, just maintenance care, maybe you do have some issues that are giving you trouble and you're looking for relief. The last thing you want to do is spend a large amount of time standing there answering questions and waiting for paperwork to be when you can try and take care of some of it ahead of time.
And then I also want to be so proactive in saying, hey, typically, even if you have a good supplement company, they won't cover the initial exam. I'd rather you pay for this out of pocket at the moment, and we'll still bill it through everything. And if we get reimbursed, then we reimburse you and write you a check.
There you go. Rather
Rather than saying, hey, a couple months down the line, okay, you still owe this amount. And then people are already like, but I've stopped coming. How can I still owe money? And I'm like, that's no fun for anyone. I want it to be more like, yep, this is the agreement we're making, and this is what we're aware of. And then you celebrate if you get a check later in the mail, too.
Right? And who doesn't like to celebrate? Let's talk about some of the reasons why these different age gaps might need, or age groups might need chiropractic care. So we'll start with the elderly since we've been talking about them. I mean, my first thought is, as you get older, you get, those pops and creaks and sounds and things. So I think that's maybe something to be treated. But then I also think I know a lot of people who, as they get older, they have, cognitive issues or other things like that come up. Or, I think about my grandparents, where sitting in a chair for too long, they'd have to stand up and, rub their legs because blood flow wouldn't be good. And part of me is going, is this all stuff that could be something treated by chiropractic?
And again, we've been through this before, so I just want to be very specific about terminology,
Right.
that chiropractic, we're not actually treating anything.
Correct. Yep.
So that it's like, again, we're more helping the body function more optimally. And I know people are like, well, that's tiny semantics. Why does it make a difference? I want to help you feel empowered in your own body. If I'm treating something, that also is more of a thing of saying, hey, I am the one making all the difference, when you're the one who, you get the ability to make all the change internally too.
Right.
And how does your body accept it, and how does it go from there? Some of the things that people end up even forgetting or just having never learned about the nervous system is that when you're feeling pain and discomfort, that's only 7 to 10% of what the nervous system can be doing.
Right.
So you're like, hey, normally when you're feeling like some of those aches and pains and kind of like those groans, you normally have some discomfort with it. Well, if that 7 to 10% isn't doing well, I want to make sure and help the other 90% of the body do well.
Right.
And even studies have shown that it's like when you get compression on some of your nerves, that over 80% of it already has to have basically been compressed before you start having any symptoms at all.
So, I mean, I'm going to use the, and I think we may have somewhat used this analogy before, but kind of like the garden hose effect, where you have water flowing through it. You don't really realize the water flow is getting restricted until it really starts getting restricted.
Absolutely. And it's like, I don't want people to be struggling then when they're, trying to age and being like, am I getting blood flow places in my body? Why do I feel so stiff? I'm like, I want older people to be able to be down on the ground playing with their grandkiddos. I want them to feel like, okay, I can go for a walk right now. And yes, everyone's a little more apprehensive about the ice and snow, and still if you could walk indoors, that might be better. But I want you to feel like you can walk. I want you to be able to grab that canned good off the top shelf without needing assistance.
Right.
So many little functional things that are so valuable that you don't even realize until you potentially lose the ability for that kind of movement. So how can we just help you really age well? Because sometimes, and no matter how good of chiropractic care you're getting and whatever other forms of care you're getting too, the body is not as young and vibrant as it was when it was younger.
That's true. I mean, we're all getting older. There's no getting out of it as hard as we try. But it sounds like a little bit of regular maintenance, we can maybe help our body feel younger for longer. Any other concerns that the elderly might be thinking that maybe chiropractic would be something that can assist them with coping with and working through?
I am going to leave it a little bit more kind of talking about some of that musculoskeletal stuff. So musculoskeletal just means more the muscles, and then the bones and how the joints work.
Right.
Because technically when you get to over 65 plus, that kind of thing, and involved with Medicare, that's the only thing that they officially cover is, hey, is this a musculoskeletal thing? Even though, as we talk about some of the other age groups, all the things still apply to elderly. It's not like, okay, now it can only be musculoskeletal stuff.
Right.
Like, yeah, digestion, sinus stuff, immune system, all those things can be impacted. But that is kind of where I typically leave it, and especially when you get someone who wants to be a brand new person coming into the clinic saying, hey, I have, weird sinus stuff going on. Can we always work on that? And they're 65 plus. And I'm like, well, yes, I know chiropractic is definitely going to help that. And I know chiropractic is going to help your sinuses. But this is really that mucky situation of, we're supposed to be focusing spine. We're supposed to be focusing musculoskeletal, even though I come in so excited that chiropractic can do so much more than just helping your pain.
Right, and that's where those weird coverages of, is it medically necessary or is it a quality of life thing kind of come into play. That makes sense. Let's go a little bit younger. Let's talk about adults. I consider myself one most days. I'm thinking I'm kind of in the prime of my life, so what do I need chiropractic care for?
And I know adult, and the way I just kind of worded it there, can just be a huge encompassing thing of age of, well, you look at young adults of, hey, they're in their 20s, they're in their prime, to, okay, well, someone in their 50s obviously has, a little bit different thought of what's going on than someone in their 20s. But some of the just general things going on, you're often in the day-to-day motion and you don't realize it until something flares up, and then you're like, ooh, that's not good. How can I lift that toddler? Or, hey, I was playing, at the rec league for basketball and doing awesome with that, and now I'm like, I kind of twisted my ankle or something.
I feel like adults, we get a little stubborn, and we think, especially as we get older, and I'm going to throw myself into this, where, you feel a little twinge, a little pain somewhere, and you go, it's fine, I'll bounce back. And then a week later, you're like, I'm still kind of feeling it. And then 2 weeks later, you're like, man, I thought it'd be gone by now. We don't recover as quickly as we used to in many cases.
That definitely can be the case. And even when we talk about like a little bit of injuries, that like typically we want to be more stubborn, and we don't always think about the beauty of the proactiveness and even just helping at high level recovery. Like, for example, since the Super Bowl was this past weekend, every NFL team has a chiropractor on staff. Like, that's a fun fact that people don't even realize. Like, wait, if NFL players are understanding the value of chiropractic, and we know that they get injuries and bops here and there and just all the tumbles and tackles and everything, they have at least one per team on staff, which is cool.
Yeah, I guess I didn't really think about that, because you always think about like the personal trainers, and you think about they have a medical staff to help them with like torn ACLs and whatever, and people who cart them on and off the field. But chiropractor, that actually makes a lot of sense. Having
You're like, it makes sense, but you would have never thought of it,
No.
and it's not like that's again the first thing you think of when you think of what might their entire healthcare team look like.
That is really cool. That is good to know. A little fun fact for everybody out there watching and listening.
So with that being said, though, if you have your own sports injuries and you still aren't at the NFL level, that doesn't mean you shouldn't have a chiropractor either.
There you go. I like it. And that could be any sport, whether you're playing, pickleball out there, or if you're a runner or whatever. The chiropractic care can definitely do some good for you.
Absolutely.
I like that. One of the areas, because that's still kind of a lot of that's focusing on injuries or that musculoskeletal stuff. Are there other areas that adults can be looking into? I know you mentioned sinuses and things of the sort. What about other issues? What about flexibility? What about I think I see a note on here that digestive struggles. I mean, as an adult, we all have that, right? But maybe I should just eat less cheese and I'll be fine, right?
There really can be so many different things. So yeah, again, still going the musculoskeletal, like, hey, if things are radiating down the arm, and these are just often things that are more tangible for people to understand of, hey, chiropractic could make sense of if I'm having pain shooting down my arm or shooting down my leg. Yeah, chiropractic makes more sense there. But what I absolutely love is when someone comes in kind of saying it's like, and it's not normally the first thing that they're coming in for. It's as we're diving into the conversation of, oh yeah, my digestion has not been pretty normal and it's been infrequent, or hey, if I eat the wrong foods, it even shows up in like bladder spasms, or hey, their bladder is off, or okay, you were sick a couple of weeks ago and I just have this lingering congestion in the lungs these days because everyone is sick, and we know we just keep passing it all around right now this season. So it's like, what is actually happening with your quality of breath and your quality of oxygen? And then we even look at it of anytime it comes to something like allergies or asthma, multiple things can be going on. One, are your ribs actually expanding as they should? Because your ribs attach to your spine.
Right.
Another thing is the brain even, again, sending those signals all the way down to what would be your lungs? And then we obviously need to be looking at still, are you even getting the air in through your nasal cavities, or are some of your nasal cavities and sinuses completely blocked up too? Okay. So there's multiple different levels of, if you're like, I just don't feel like I can take a deep breath, well, is the chest even able to expand? Is it more the signal pathways, or is it even some of the internal area to get oxygen in?
So many multiple things that are kind of contributing to that.
And it could be a little bit of a percentage here, a little bit of a percentage here, and a little bit of a percentage here. And you don't even necessarily realize that, hey, maybe the signals from the brain to the body just haven't been working well, until you're like, I literally am so stuffed up, I can't utilize any of this.
Right. Now, we talked before a little bit about kind of opening pathways in the body. And as an adult, I think about how, we find ourselves in a lot of situations where we are a little pent up, a little tense, whatever. Be it you're at work and you're all day on a keyboard and everything's kind of closed up, you're looking down at a screen, or on our phones or whatever. We sometimes do this for 40 plus hours a week. And
then you wonder why, hey, even just lay flat, or when I give the instruction of like roll up a towel or blanket and lay it almost vertically along the spine and just lay like a T on that, and people are like, that feels so good, and also like that's almost so hard. I'm glad it's not anything firmer than a towel or a blanket. I'm like, yep, even foam rolls can be beautiful because people are like, I get to just roll and open up over that, but so many times those shoulders are just so rolled forward, and the body is in this fight or flight, protective fetal type position that we can't even get it to open up.
Which leads into another thing we've talked about before, which is the change in our body stature and how we hold ourselves and position ourselves when we feel comfortable in that natural state. It can affect our mood a lot more than we realize.
One of the beautiful things that I love to always reiterate about chiropractic is an adjustment to the spine impacts the prefrontal cortex of the brain. So when we're adjusting the spine, it's impacting the brain, and you're like, okay, cool. So that's where we make decisions. But people also forget that's where you regulate some of your mood. That's where you regulate what kind of planning am I doing?
Right.
What type of reasoning do I have? Okay, where am I going in life? What dreams, what goals, what visions do I have? And if you literally just have lots of hammering and hammering and hammering on those areas of the brain, and you're not even thinking about the spine, and your brain is just so overwhelmed, how can you be a full expression of who you are meant to be?
Right. We are talking with Dr. Ellie with Generations Chiropractic. For those who are just tuning in, you can give us a call if you have a question. You can call us at 920-885-4446 or call and text us at 920-887-9595. I'm imagining, Dr. Ellie, you've had people who've come in and seen you for regular chiropractic care who've probably just anecdotally mentioned things like, oh, I feel like I'm more focused at work, or, now when I go for my morning walk, I'm able to add on an extra block or two or a half mile or more. When I get up in the morning, I get up. I don't, crawl out of bed. I jump out of bed. Mm-hmm. And, how long does it take for you to kind of look at him and go, there might be a connection there?
One of my favorite things is still last summer, there was an older lady who came in and, Medicare age, that kind of thing. So we really are keeping a little bit more of the conversation all musculoskeletal and working more in pelvis and lower back. And by the second or third visit, she's like, is there any reason this could be impacting my bowels and how I'm eliminating? I'm like, you put two and two together already. Like, awesome. I wasn't even like planting those seeds. And like, yes, I want to be doing the education of planting those seeds, but I'm like, that early on, it's still so much of what I want to help educate is notice what you notice in your body. Do things feel a little looser? Do you feel like you can move better? Yay or nay? And she was literally already noticing my digestive system is changing. And I'm like, beautiful. Like, and it's so cool when people can internally realize that prior to me saying, this is going to impact your bowels and this is going to impact, your reproductive organs and this is going to impact all that. Because who knows, you might have 100% fantastic functioning to those areas. And other times I'm not even going to bridge the gap of if I feel like I'm getting near a perimenopausal phase or anything like that, because that's just taboo. Why would I talk to my chiropractor about that?
Now, I do see we have a call, so we're going to go ahead and go to line one. Good morning. You're on with Dr. Ellie.
Hi, Ninja. How are you?
Doing very well. How about yourself, Tyler?
I'm doing pretty good. Happy early Valentine's Day, by the way.
Thank you.
Yeah, my question for Dr. Ellie is, I've done it numerous times where I've just sneezed, and I just happened to turn on the right spot, and I pulled a muscle in my back. How would you go about getting rid of that?
It's a good question.
Yeah, I was going to say, when it comes to a pulled muscle in the lower back or in the back as a whole, you first off should remember that muscles attach to bones, bones attach to muscles. And the nervous system is what controls where is the joint positioned in space and what kind of signals are we sending to the muscles. So when you have something that's pulled, normally it ends up being a little bit more in spasm and there's a lot more inflammation in that area. So number one thing I would be saying is we got to get those signals turned on. We got to be able to tell the muscle, you need to chill out, areas around here, we need to remember back where we're supposed to be in space, getting rid of some of that inflammation. So definitely some chiropractic care is a beautiful thing to be helping out with. There are other things that I am along the lines of gentle motion to tolerance if you don't have the immediate ability to be getting in with a chiropractor. But yeah, super important to be getting good communication, because also even if you then get to the point of muscle seems like it's healing, seems like I'm not having that pain or discomfort, because there probably is pain and discomfort when you pull a muscle, that we're never actually going to be addressing the underlying issue without getting good signals to that area too.
Makes a lot of sense. Tyler, thanks for your call.
Thank you.
There you go. And I mean, that kind of touches on something kind of important, because a lot of times if we do pull something, we feel that twinge or whatever. If it goes away on its own, we immediately say, oh, I must be fine. I must be better. But there could still be something that's not quite in alignment, something that's not where it's supposed to be. And it's essentially just another twinge or spasm waiting to happen.
You've gotten already used to that 80% compression on that hose that we talked about earlier, that you're like, hey, I'm used to 80%. Now I'm just going to function like 80% is what my capacity might seem like.
Right. That does make a lot of sense. I want to dive back into the story we're talking about with the lady who mentioned that it was having an impact on her bowels. And that's something where that's a conversation that she may not even have had when she came in. She may not have said to you like, oh, I'm having issues with,
Absolutely not. No, like that wasn't, sure, I put it on the intake of what might all be happening, but no, that wasn't anywhere actually that we discussed.
Right. And yet at the same time, that then is something where it's still something that could be affected by what's happening. And that's why when you're doing these intakes and you're talking to people, you might ask some odd questions and questions that people will go, well, I'm not going to tell her if I'm having bowel issues because that's not related to this. But in the end, it very well could be.
And mental health can be another thing that people are like, well, I've kind of worked through some anxiety, some depression, but I'm like, I'm good now and don't even want to talk about it either. I'm like, I understand. I'm not a mental health counselor or therapist, but how we talked about how it impacts that prefrontal cortex of the brain, like we've seen a lot of impact in some of those areas too, that I'm like, yeah, they might be a little bit more taboo, or why am I talking with a spine doctor about these things?
Right. Yeah, we get pretty judgy when it comes to that some stuff, don't we? Let's move it down from adults now. Let's look a little bit at one of the areas that you focus on, which is kids. And that is kind of a big area. When I think about kids and I think about, that is kind of the late stages of development when it comes to that, babies, toddlers, into kids range. And there is still development happening, especially when you get into like that puberty range, bodies shifting, things are molding into what should be their final position. There's a lot of changes happening.
Absolutely. And can be, again, kids as a whole. When I just say, hey, we're talking about kids, like that's a huge range in itself that I'm like, wait, are we talking about sometimes still the younger ones that we're working through a little bit more? Can we sit still in a classroom? Is it just normal wiggles in a classroom, or are we more starting to kind of discover, is it a little bit more kind of like an ADHD or behavior thing? Or I know we've mentioned this before, but those spinal reflexes that we had talked about, that it's like, hey, if your body is trying to retain things that it's not supposed to retain because it doesn't have good communication, it forces you to want to be wigglier because you can't sit well in a chair. Right. And some of those signals can all be settled down through chiropractic care again and getting some good signals there. And then it might be, okay, more the 10 to 11, 12 range, and you still have some bedwetting issues at night. And, okay, this is literally starting to now impact, this is when we're in middle school, we're supposed to be able to have sleepovers and that kind of fun thing, and you just don't even think about, okay, sometimes, 5, 6, 7, okay, you're not necessarily having all those sleepovers quite yet. So, like, what is something that is impacting that I can't hang out with my classmates in a fun way?
Right.
To then you sometimes get a little bit older, and it doesn't mean that you need to be older, but you look at competitive gymnasts, and that's where you often see the most cases of scoliosis showing up. Or just even as a whole, you have females that tend to show up more with scoliosis in youth than males. Some of those things are like, wait, these are big keywords that you are like, this would never impact my child, or why would my child ever need chiropractic?
Right.
But things that can really impact day-to-day life, and you don't even necessarily realize it.
Now, scoliosis, that's is it like a curvature of the spine?
Yes. So normally what will end up happening is your mid-back, the primary thing will kind of be, you're supposed to have a nice curve forward to back, and it ends up kind of also curving left to right. And that's not ideal, is when you have more of that left to right or right to left curve there. So you'll end up noticing, hey, the hips are normally quite uneven because people are like, you notice it in your mid-back, and one shoulder ends up kind of being hiked up more towards the ear, or in schools and even in doctor's offices, they'll have you bend forward and they kind of like quick run their hand along the spine. And it's like, oh, yep, this does seem like it's really curving out to the side. People are so focused on where they're noticing that curve that you don't even often are informed that it's coming from the pelvis, and that the pelvis is unlevel to begin with. So as the pelvis is so unlevel, it's normally so unlevel in the opposite direction that you're noticing if it's high on the left, then your spine will curve out to the right in your mid-back, and people are so focused, what's happening in my mid-back, that they don't even notice what might be subtleties actually stemming from the pelvis.
And that's a great reminder that, the song that's out there, I always love this song, the hip bones connected. Like, they really are. They're all connected.
Mm-hmm.
And, if something's a little off in your feet, it can affect up one leg, it can affect into the hip, it can affect all the way up.
And you have this really cool, it's called the writing reflex. Not like, I'm going to write something down of
Right.
W-R-I-T. I'm not good with spelling. Anyway, that it's saying your eyes want to do everything to be equal and see everything basically parallel to the ground on the horizon.
Right.
So if that means to get my eyes on a nice level, even playing field, and if my hips are tilted one way and my shoulders are tilted another way, your head is going to then tilt to make sure your eyes are nice and level too.
So, and we've talked about this before, that's how, because you've talked about noticing if you talk to people and they've got kind of a tilt to one way or the other, that you're like, okay, maybe there's something else.
And this almost jumps back right away to when we talk about infants. I know it's like, hey, we kind of are talking about kiddos, then we might hit toddlers and infants, but I'm going to jump right away to those infants in those car seats. That head tilt, how are they first starting to learn to perceive the world? Because so many times if you look at them in a car seat, a lot of times, since they don't have some of the neck control, or people are like, no, they're just kind of, their head and neck is just weak and floppy. Well, other times there's a lot more actually spasm going on, that they're like 100%, baby only rotates the head and tilts the head off to the right side. That's leading a little bit more to torticollis. And then more importantly, how are you viewing that horizon as an infant when you're still in the car seat, before you're even out and about moving and crawling?
I hadn't even thought about that, but yeah. And now I look back, I'm trying to think of my kids, and, there are times where, they're watching TV or something, and they're like, oh, maybe that wasn't okay. The head just tipped off to one side.
And there are times that other people are like, hey, I'm putting the infant in the car seat. Sometimes, again, the head flops a little bit more to one side or the other side. I'm like, yeah, again, especially like that under 3 months age, like they still need to learn how to gain musculature. Like that's the whole purpose about 3 months, is when you want them starting to lift their head up and lifting their torso up to gain some of that strength. So it's like, to some extent, if it's a little floppiness side to side, at such a young age, I'd rather see that than we only rotate this one way, and that's how you're only ever going to perceive the world, if you can only go one direction.
Well, let's dive in a little bit here. Let's kind of combine up the babies and toddlers and the kids a little bit and talk about kind of that change, because there's a lot of development stuff going on there.
Absolutely.
And there's stuff that's normal development. When a baby's getting into that, that advanced baby stage where crawling is happening, rolling over is happening, sitting up is happening. They're learning their own bodies and how to interact with their environment. And if things are not where they're supposed to be, out of place, misaligned, whatever, development cannot progress properly, or they might interact with their environment in a way that we look at and laugh, like, oh, look at little Timmy, he scoots around on the floor with his head touching the floor. Whereas, from a chiropractic standpoint, you're going, that's not normal.
Well, the first 2 years of life is where the most brain development occurs. So it's like there's so much development happening in the womb, in utero, and then you're going, okay, infant stages, and you're like, but this little 3-month-old is just laying there not doing anything. Mm-hmm. Like, okay, enjoy those baby snuggles. And then when you start to getting the rolling, the sitting up, the crawling, there are times I'm asking parents questions, and it's not to quiz the parents. It's just to have them think about it in a little bit different way. Of, you're like, oh, someone comes in and is so excited, baby's rolling now, or or baby's crawling, and I'm like, awesome. And I'm like, so are we rolling back to belly? Are we rolling, back to front? And then are we rolling both, left and right and left? It's like, oh my, I was just excited to see my baby roll.
Right. And as a parent, that's easy to do.
And I want you to also celebrate that you're like, hey, look at these beautiful steps that your child is taking. And then next time they're able to go home and look at it a little bit more quizzically. And if they do come in, they're like, now that you mentioned that, baby rolls so much more often to this direction than the other direction. I'm like, okay, that's something for us to note. And I probably even starting by asking that question based on different patterns I'm noticing in the baby as I'm getting the baby adjusted. That I can notice patterns that I'm like, ooh, probably not a tendency that you want to go this direction. And also I celebrate if parents are like, nope, it is pretty equal side to side. I'm like, awesome.
Now let's talk a little bit about adjusting babies. When people, and we talked about the start of the show, when people think chiropractic care, they immediately jump to the quick motions, the pops, the snaps, the cracks, the bone breakers, so to speak. And then when they think about, well, babies getting chiropractic care, you're not out there putting baby in a half Nelson to, pop a shoulder or anything like that. It's a completely different level of care.
Such a different approach. And then even when you think about the birth process in itself, it doesn't matter whether it comes out naturally or through belly. That's so much pressure on baby and so many more forces on baby, that significantly more than what we ever do as a chiropractor, but yet we're able to help, I'm going to say, kind of undo some of that birth trauma, because no matter how baby comes, it's a big process for mom and baby.
Yeah, I mean, there's a lot of compression there for the body to fit through everything it's got to fit through.
And the body is obviously designed to be able to withstand some of that.
Right.
So when we're even looking at adjusting a baby, it is like the amount of pressure of, touching your eyeball or checking the ripeness of an avocado. So it is fingertip pressure, but it's in very deliberate patterns and awareness and different spots to be checking, that we get to help unwind this baby into more of a calmer, chiller state. Because so many times we'll have, babies that might come in of, hey, first 2 weeks of life, very often babies are like super chill, everything is good to go. Well, this is even something to be said for, depending on if you get an epidural or Pitocin or some of those things to impact labor, it can still be lingering in the body system for even up to like 10 days afterwards for the infant.
Right.
So people are like, dude, my baby's so chill. Well, maybe it honestly has a little bit of some of those medications that were helping to block some of your own discomfort.
Right.
And then they're like, why is baby crying? Why is so much going on? And I'm like, well, one, baby is in itself a little bit needing to detox, and two, what is going on with their tummy? Do they have, and colic isn't normally diagnosed officially until like 3 months, and colic is more the gassiness, I think the official diagnosis is 3 hours of crying for like 3 days a week, lots of crying, and you can't
Right.
just settle this child down. Normally it's a lot of gas and digestive stuff related. So working through more tummy stuff, digestive stuff. And we even need to think about, how are the kiddos breastfeeding, or are they taking a bottle? Are they able to get a good suck and a good latch? Or a big key word recently has been tongue tie, and baby basically can't even stick out their tongue, or their mouth is again like tied together too tightly.
Right.
Do we have to work through releasing these tissues? Do we need to just give a little bit more assistance in, hey, trying to finagle different positions? But how can we help release all these tensions so that we're not gulping in air? Because if you start gulping in air while you're trying to eat, that's not going to do well for your tummy.
Right. Well, and we've talked about where that's another area where when moms bring in baby in for care, you're going to ask a lot of questions. You might ask, are you bottle feeding or breastfeeding? Does the baby eat better on one side as opposed to the other? Because that could be an indicator, right?
And they're all a lot of questions I ask, and it's not to be feeling, okay, is this a judgmental thing of, no, I've chosen not to breastfeed, even though some things say breastfeed, and some things say don't breastfeed, and some say bottle is bad, and then you hear all these other pressures of, am I going to vaccinate? Am I not going to vaccinate? Am I going to let my baby cry it out, or am I going to co-sleep? All of these different things that moms are working through, so many struggles that, hey, here's education, here's information, and I want to support you in your journey. No matter what decision you choose that's best for you and your family, I know chiropractic included in that process will always help.
And of course, with all the stuff that mamas are going through, it's not just post having that baby, but also the prenatal stuff, and you work with that as well. We've talked about how chiropractic care can potentially lead to shorter labor times in some cases, but I think for me the most important thing is comfort. There's a lot of changes going on in a pregnant mama's body, and comfort is usually not something that's easy to find.
And one of the other things, how I was kind of just starting to ramble into what might be that postpartum of what are all these decisions, I like to be able to incorporate in that prenatal time frame of, hey, have you started to think about some of these things so that it isn't a reactive decision in the end? That it's how can we figure out a little bit of what might be your best birth plan, even though so many moms are coming in saying, I'm feeling hip pain, like you expect me to sleep at night, like all I want to do is sleep, but just laying on my hips is so much, or baby seems so much lower compared to the previous pregnancy. What's going on here? You know, a lot of pubic bone pain, and they're like, stuff is like shooting down my leg, and hubby doesn't understand this at all. I'm like, yeah, hubby won't. So sorry about that one. It's how can we help you feel good in your body? Because I want you to still be able to be mom, especially if you have other kiddos too.
That does make a lot of sense.
And typically, if it's not your first pregnancy, you might have symptoms that would show up earlier than in your first pregnancy anyway.
There you go. A question we got late after our last time together that I remembered to write down and ask you about this time. Somebody asked about, is it still possible to get chiropractic care post having a joint replaced? In their question, I think they had said that they were like a year out from having a hip joint replaced, but they were told by somebody, probably a family member, because family members always give us the best advice, that they couldn't get chiropractic care because once you've had a joint replaced, it's artificial and chiropractic doesn't work right.
For those of you who didn't see on the video, hopefully the eye roll wasn't too obvious there. Definitely can still be getting chiropractic care. There are certain things that we definitely need to be aware of depending on, okay, hip replacement, that's one of the easiest things that I actually see so often. Hips and knees getting replaced, yep, easily can still be getting the spine adjusted. Are there certain styles of how we do adjustments that you definitely should not do if you have a hip replacement? Absolutely. Like there are limitations in that sense, but other times people are like, hey, I've even had different segments of my spine fused together. Can I still get chiropractic care? And I'm like, yes, because we want equal motion at every single level of the spine. And especially if you have fusion, that means one area is going to be more locked up and other areas normally want to then start to move too much. So we want to make sure we're regulating I'm not going to be soldering and, adjusting through steel.
Right.
But I want to make sure everything else in the body is communicating and moving as it should.
There you go. And that's kind of what it's all about. We want that communication. We want that movement. We want the body to be feeling its best so it has that best opportunity to let you kind of be comfortable and let you be who you are.
Absolutely.
Which is huge. I want to remind everybody again, 920-885-0641 is the number to call if they want to, or text. Text more important is better, I should say. Not more important, but is a better way. If they want to set up something, or they can also go to your website, which is generationschiropracticwi.com.
Yes.
Perfect. Okay. You have me second guessing there.
Well, I was like, no, it's at gmail.com, but I'm like, that's the email address.
There you go. So same thing, but at Gmail is the email address, and they can also find you guys on Facebook as well. And highly recommend checking out, reaching out if they have any questions or concerns.
Yeah.
Dr. Ellie, always a pleasure having you on. I never know what we're going to talk about, but I always have a great time, and look forward to having you again soon.
Most of the time, I don't know what we're going to talk about either, so we just roll with it.
That's what we do, and we have fun with it, as always. This has been a paid program. The advice and opinions expressed on the program are solely that of Generations Chiropractic, not necessarily WBEV or Good Karma Brands.